guys, today we'll be talking about safe zones for MSI. Now what is an MSI? MSI is mini screw implants, is a type of temporary Anchorage devices, could be used in orthodontic purposes. So now what are safe zones for MSI? Safe zones, as we can see that safe zones consist of the placement sites. So first, choosing the site of MSI, it depends on four structures. First is the desired biomechanical advantages. Now what is this? It states that what do we want to achieve? It all depends on that. What do we want to achieve? Do we want retraction? So in case we want retraction, the MSI site placement will be changed. In case we want intrusion, there will be different site of placement. Okay, is cortical bone thickness. Now why do we need this? We need this because MSI's diameter is 1.2 to 2.7 mm. What is the diameter of an implant? So why cortical bone thickness is an important factor, as we know that in the posteriors and in interiors there is different cortical bone thickness. So it all depends on that, and moreover it also depends on the interradicular area. Now, radicular bone volume. Now interradicular bone volume, what is this? This suggests that we need enough bone density, enough bone volume to place our Miniscrew. Last is proximity of vital structures. So we know that proximity of vital structures, for example like our neurovascular bundle, or we have our inferior alveolar canal, mental foramen, we want to prevent those sites. We don't want to place our implant near to those. Now coming on to MSI sites. Now what are the safe zones for placing MSIs? What are the sites which are safe for placing Miniscrew implants? So there are three regions: posterior region, anterior region and other regions. First, discussing about the posterior regions. Most frequent sites are the interradicular bone in maxilla and mandible. Most frequent sites are the interradicular bone. As we can see in this diagram of maxillary posteriors, you can see that this interradicular area is the safe zone for placing MSIs. 1 between the first molar and second molar, 2 between the second premolar and the first molar. Then posterior region for palate. When we come on to the palate, we can see that there are three safe zones for MSI placement. First is between the two premolars, the first premolar and the second premolar. The second region is between the second premolar and the first molar, and the third is between both the molars, the first molar and the second. Now after these placements, the thing to keep in mind is that more apically our MSI will be, and safer will be the placement of Miniscrew implants. Now as we discussed maxilla, we come on to the mandible. Here we can see that it's same with maxilla and with mandible. You can see that there are two sides. The interradicular area is between the roots of the tooth. Interradicular, in between the roots. So the first site is between the second premolar and the molar, and the second site is between both the molars, the first molar and the second molar. We come on to the anterior region. In here, what are the optimal sites or safe zones for MSI implant placement? In maxilla, the MSI, the optimal site for MSI placement is between the central incisor and the lateral incisor, which is 6 mm above the cemento-enamel junction in the labial cortical plate. So this is the site of insertion for MSI in the maxilla. What is the safest, the optimal site for MSI placement in maxillary mandibular anterior region is between the lateral incisor and canine in the interradicular area. Lastly, other sites for MSI placement could be infrazygomatic area, retromolar area, the mandibular symphysis, and maxillary tuberosity.